Think about how you feel after a long walk or hike, how your feet feel. Sometimes they're sore, sometimes they're painful. Usually rest will help and then it goes away. So sometimes it doesn't. And if it doesn't go away, if there's pain in the heel, pain in the feet, sometimes that can be plantar fasciitis. But what do? How do you make it better? Do you ice it? Do you rest? Conservative treatment with physical therapy can be helpful with plantar fasciitis. And in this video today, I'm going to tell you about plantar fasciitis and how physical therapy can help. Hi, my name is Caroline Pitts, and I'm a licensed physical therapist at EW Motion Therapy. I treat often patients with plantar fasciitis, and today in this video we're going to discuss what plantar fasciitis is, what the risk factors are, and how physical therapy can help with it. Plantar fasciitis is inflammation on the bottom side of the foot, or the plantar fascia area. It's a thin ligament that connects the heel to the front of the foot, and it absorbs shocks and stresses with different walking, running, or just sports activities. Plantar fasciitis usually presents as heel pain. Things that can exacerbate the condition include prolonged standing or walking, introducing a new exercise activity, tight calves or general weakness in the foot or around the ankle. And then for some people, pain is worse in the morning than it is in the evening. Plantar fasciitis can sometimes be caused by bone spurs that are calcium buildups in the foot or the heel that will rub against that tissue and cause discomfort. The best course of action here would be to contact your doctor and possibly get some imaging done, because sometimes there can be more damage done from those bone spurs. So getting a doctor's opinion on this would probably be a good course of action. Plantar fasciitis is very common, but there are groups that are at higher risk than others. Runners are at a higher risk with putting as much strain on their feet and their bodies as they do. People ages 40 to 60 are at a higher risk. People that are overweight, people that have flat or high arches are at more risk. Those that are on their feet all day, kind of like teachers, and then also poor or ill-fitting shoes can be a risk factor here as well. Conservative measures like physical therapy is usually the most effective treatment for plantar fasciitis. When we're doing physical therapy, our goals are to reduce the pain, but also to return you to function at full capacity. In physical therapy, the tools that we'll usually use are massage or manual techniques to loosen things up. And then we also will go through some stretching and mobility sequences along with that. Weakness is usually involved, whether it's at the feet or sometimes up through the hips. So strength exercises are also involved. Based on your physical therapy, they can usually assess you and see where those strength deficits are at. Ultrasound can be used to break up those adhesions in there. Home exercise program is a big component as well. So you'll be given exercises to work on. The more compliant you are with that, the better those outcomes usually are. Physical therapy can take anywhere from 4 weeks to a couple of months for treatment, just depending on the severity. The length of that treatment will depend on the amount of damage that's present, but also the amount of stress that can be reduced in that affected area. Now you know more about how physical therapy can help with plantar fasciitis pain. Reducing inflammation is a key component here. And if you need more information about reducing inflammation, you can click our link in our description below to watch our video, What is Inflammation?
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.